Myself, Dr. Sneha Bawiskar. I'm a neurophysiotherapist and I'm actually practicing in Pune currently with 1 year of experience.
In these years of your experience in the clinical practice of physio, is there any two things that you missed in your practice, and after attending the workshop and then you learn, oh, okay, this is new skill?
Okay. So I don't think there's just two things, to be honest. There are a lot of things that I've learned from here. So first was complete thorough assessment, how we need to brush up with the assessment. And second was about the techniques that we should start from basics and then land up to walking, which I think were lacking in all the SCI patients.
Okay, that's very, very good. Before coming here, before joining the workshop, your expectation, and after joining the workshop, what did you gain?
Okay, so I gained the knowledge about more of the equipments that can be used because these equipments needs to be modified according to the patient's needs and according to every conditions. So what are the equipments we should have, the setup, the foundation that needs to be started with, those points were more highlighted, I think, in the workshop.
Okay, that's interesting. Our setup in our clinic is set up in such a way that you don't need help from any other supporters, and the patient will perform the effective exercise for a purpose that you want them to do. And my next question is that after now that you have attended the workshop, would you also like to recommend to your colleagues or any other friends to join our further days workshop?
Definitely, I will recommend, because there are a lot of therapists out there, neurotherapists. They should attend the workshop specifically designed for SCI patients who are currently treating SCI patients. They need to actually go through all the techniques, so to just brush up the knowledge more.
Can you give a few words on Ravi sir, as you already met him, and his vision on Mission Walk?
Okay. So I have been following Ravi sir since a very long time, and actually by Ravi sir, but Mission Walk since a very long time. I was here, a year back I was here for the interview, but I couldn't go ahead because of some logistic problems. So what I feel about Mission Walk and Train the Therapist is they have started a good initiative where people are coming from different states or across India to learn about these techniques, and I'm very thankful to him for this initiative.
Okay, thank you so much.